Shin splints, or pain on the inside of the lower leg, often can be associated with increases in running load and high load jumping activities. When we actually look at a model of this is a model of the lower leg through the inside part, and if you look on my particular leg through this region here, often pain can start occurring through this region when we increase the amount of running we're doing, for instance, the distance or even the pace. It can also be produced by an increase in training frequency. It can also be increased in a change in training activity. For instance, we may be doing some repeats, we may be doing short hill work, and we may also be including different activities, so some high intensity training or HIIT programs that will start to produce a little bit more load through that area. It also can come on from an increase or a change in running shoes as well. What we do know is that the structure that's actually damaged in this area can either be the bone, and we can produce a stress fracture through the inside of the bone. The second condition that can occur there is what we call medial tibial stress syndrome, or MTTS, and that's actually just a muscle irritation where the muscle inserts into the bone. And the third condition that can occur is what we call a compartment syndrome, and a compartment syndrome is a build-up of pressure in the compartments deep inside of the leg through this area. And that's less commonly occurs with this particular condition. The most likely, what we call etiology, or the most likely diagnosis, is either a bone reaction or an MTSS, a build-up of pressure around the, is the bone stress reaction or an irritation of the muscle as it inserts into the bone. So a shin splint can be one of three conditions, again in summary: bone, the insertion of the muscle into the bone, which is the MTSS, or thirdly, a compartment syndrome. The most likely usually are going to be either a stress reaction or the muscle type of problem. Now, insofar as the diagnosis of this, the definitive diagnosis, if we think it is a stress reaction, is a bone scan, and that is where we inject a small radioisotope, a phosphate radioisotope, and that attaches onto the little particles that are developed down around a stress reaction, and then you do a particular scan. That's a bone scan. It's a little bit more complicated, but it's very sensitive to detecting a stress reaction. The second thing we can have done is a MRI, and MRIs are pretty good at looking at bone stress reactions. Not quite the same sensitivity as a bone scan, but in an environment like Singapore, we probably would send you for an MRI, mainly because there's only, I think, 2 places here that will allow you to do a bone scan. CT scans, and a CT scan is also quite sensitive. A CT scan, in fact, combined with a bone scan called a PET scan, is actually very sensitive. Doing an ultrasound is not probably, if done by a very skilled performer, skilled clinician, may be useful, and a plain X-ray is probably not going to show you too much. So if we're looking for a specific diagnosis with a scan, we're probably looking at an MRI or a CT bone scan or a bone scan. Would I send people off for bone scans at the beginning? One of the advantages of actually getting a diagnosis with this is that it allows us to know exactly what it is, so we know how to treat it. If you do have a bone stress reaction, it will take approximately 12 weeks to heal. So there's no fast tracking this. It takes at least 12 weeks, and it's 12 weeks of no running. So you can go through and do the strengthening, cycling and other things, yoga and so forth, but you can't go through and do running or high load activities. And thus we have 2 choices at the beginning. If we think it is a stress reaction, it's pretty simple. It's not 6 weeks off. A lot of people fall into that trap of only giving it a small amount of time. You need 12 weeks. If you don't have access to an MRI, you don't have insurance and so forth. our suggestion, unfortunately, is a 12-week rest period, because if you just give it 4 or 5 weeks, 6 weeks, and go back and run, you'll then develop more of a stress reaction. It's going to take you another 6 weeks. So if we're thinking it is a stress reaction, unfortunately, generally 12 weeks. If you want to be 100% sure with the 12-week sitting out period, then we'd actually get you to go through and do an MRI, which are pretty sensitive to picking this up. The bone scan's still the most sensitive test, though. During this rest period, what's really important is to do a strengthening program to increase glute, calf, and hamstring strengths and balance. Second, we do some stretching of the ankle joint, what we call a big toe stretch, an Achilles stretch, and a calf stretch. We also get you to try and continue doing some cardiovascular exercise to try and keep the weight down so you don't have too much of a BMI, high BMI, which also will add to this. Medications and so forth. You can use a short course of an anti-inflammatory, but it isn't going to change things greatly. Rarely do we ever put anybody on crutches with these and take weight off it, because usually people can walk around without too much discomfort. Then once we get you to go back and into the running routine, so if we were to diagnose a stress reaction and it's 12 weeks off, at the 12-week mark, once we get you to go back, we don't just throw you back into running. At around about probably the 10-week mark, we can start you on a very low impact, what we call pre-jumping program, in preparation for a return to interval running on a treadmill, which will be high cadence running, which is lots of little steps to reduce the amount of force. And then at the 12-week mark, then we start you off with a small running routine, an interval running routine on the treadmill, soft surface, high cadence, lots of little steps, which puts less pressure through it. Forces you to go onto your toes, which is actually better for shock absorption. And then we progress you back into a running program. And the important part, the take-home message here, is when you return to the running, probably one of the causes of this why it occurred at the beginning is because you increased your load too quickly. So you're only going to returning at an increase of 10% of load per week. So if you started with a run of 5 kilometers, we'd only increase it per week of 10% of 5 kilometers, which obviously is only a very small amount, and we add that on, and we only increase that load by that 10% per week. So if you started at 5 kilometers, it's going to take you 3 months to get up to 10 kilometers, to give you an idea. So it shows you that when we do start loading you after you go back, it's a very small incremental increase. Otherwise, we'll produce the same problem. Obviously, things like running shoes can have an effect on this, but realistically, the big thing for us will be running technique and running load, and making sure that you're stronger afterwards. I hope this little instructional video has helped you understand a little bit more about stress fractures and shin splints, commonly known, and we look forward to helping you through this routine. Thank you.